Hey, my name is Julia Womble, and this is my presentation on the national opioid crisis. I'm going to introduce my audience. This is Lindsay. She's an RN in radiology. This is Tyler. He's an RN in radiology. This is Megan. She's an X-ray tech. This is Emmy. She's an X-ray tech. And this is Caitlin, and she's an X-ray tech. All right. Okay. The national opioid crisis is a huge health problem in the United States, affecting many people, families, and communities. The crisis involves the misuse of opioids, which are drug-like prescription painkillers, heroin, and synthetic opioids like fentanyl. The crisis started in the late 1990s when drug companies convinced doctors that opioid painkillers were not addictive, leading to a big increase in prescriptions. The crisis in the 1990s began when drug companies heavily promoted opioid medications like Oxycontin, and doctors started prescribing them more often. These companies said these drugs were safe and non-addictive, which is not true. Many people became addicted to these painkillers, and when they could no longer get prescriptions, some switched to heroin. The opioid crisis is very large. Nearly 450,000 people died from the opioid overdoses between 1999 and 2019. The crisis has three main phases. The first phase in the 1990s with the increased opioid prescriptions. The second phase around 2010 with more heroin overdoses. And the third phase starting in 2013 with a rise in overdoses from synthetic opioids like fentanyl. The crisis has caused many problems beyond death. It has overwhelmed healthcare systems, burdened law enforcement, and hurt families and communities. The economic impact is huge, including costs for healthcare, lost work, addiction treatment, and law enforcement. Many efforts have been made to tackle the opioid crisis, including regulation and monitoring, using systems to track and control opioid prescriptions, education and prevention, teaching people about the danger of opioid misuse, and promoting safe prescribing practices among doctors, treatment and recovery, providing more access to treatments for opioid addiction, including medications like methadone and Suboxone, harm reduction, implementing strategies like distributing naloxone, a drug that can reverse overdoses, and setting up needle exchange programs to prevent diseases, law enforcement and regulation, cracking down on illegal opioid distribution, and holding drug companies responsible for their role in the crisis. Recent efforts have shown some success. For example, making naloxone more available has saved many lives, and limiting opioid prescriptions has reduced new addiction cases. However, challenges remain. The rise of fentanyl, a very strong synthetic opioid, has increased overdose deaths. The COVID-19 pandemic has made things worse, causing more substance use and overdose deaths due to isolation, economic problems, and disruptions in addiction treatment. The national opioid crisis is a complex and ongoing health problem that needs continued efforts to solve. While progress has been made, more work is needed to improve treatment, prevention, and support for affected people and communities. By continuing to enhance treatment, options, and prevention strategies, there is hope for overcoming this crisis. Okay, y'all all have a little pamphlet in front of y'all. The first page is the signs and symptoms of opioid abuse in healthcare providers and non-healthcare personnel. The first one is the signs and symptoms of the healthcare providers. Some that you could see that would be signs and symptoms of opioid use in those are tardiness, changes in productivity level, difficulty making clinical decisions, documentation errors, and disheveled appearance. And those in non-healthcare are lack of hygiene, weight loss, changes in sleep pattern, and isolation from family and friends. If you flip that page over, I have 4 ways I have listed here that you can help combat the opioid crisis in the community. Number 1 is educating the community about the national opioid crisis. 2, support drug prevention programs in the educational system. 3, education on alternative treatment options. 4, assessing for risk factors for opioid abuse. And on the last page that I have there for y'all it says that, in conclusion, the opioid crisis is real and it is important for the healthcare providers to join the fight against opioid abuse. Opioid misuse and addiction does not discriminate. As nurses, it is vital that we utilize our skills, research, and technology to improve our practice. The statistics are astonishing, and working together as healthcare providers and with our communities, we can make a positive impact on the national opioid crisis. Thank y'all for listening to me about my topic on the national opioid crisis.